Hello, everyone. Welcome to another episode of Unlearning Religion. You got your cast here, me, Rob, with Tony and Jarvis. Say what's up, everybody.
What's
What's happening?
What's happening?
Y'all see, we're in a different setting here. Normally, we are in our studio setting, but we decided to do something virtual. So, and we also have a special guest that we're about to introduce shortly. Right now, what we want you to do, though, is what we always ask you to do. Go ahead and share. Let folks know that about this podcast, right? Go ahead and subscribe to us as well. We're going to get into a really, really, really dope discussion, which is why we have a great special guest here. Our title is Mental Health Crisis or Spiritual Warfare. And as you all know, over the last, and I would say really over the last 4 or 5 years, there's really been an uptick on a lot of back and forth about what mental health is versus what demonic demonic presence may be, and all of these different things. And so what we thought it would be really cool to do is to bring someone who is a specialist in this area, and also, from what I understand, has been or is a pastor as well. But we're going to let Tony actually introduce her, because I feel like this would be really beneficial. So Tony, go ahead and take it away.
All righty. So this guest is kind of special to me. About 3 years ago, 3 years ago, I started unpacking some stuff on my own. I don't know if COVID kind of provoked that, or just getting older and going through a lot of life transitions. I actually know Dr. Ade. I was going to call you Apostle. Dr. Ade, just sister churches back in the day. Oh man, this is before me and Steven even started started dating. So just to give y'all a little bit, because she got her own credentials. I kind of grew past that whole count. I want my people to have some credentials. I'm just at that point now. I don't want nobody winging it with my mental and spiritual health. So she is more than qualified. She is a native of Philly. She is also the overseer right now of Sanctuary Church or Sanctuary Village.
Covenant Christian Fellowship International, and Sanctuary is one of the churches. Yeah,
is one of the churches in that fellowship. And so, like I said, she gives that young love vibe, but it's so straightforward and to the point. And like I said, she's helped me a lot in my self-awareness, my unpacking, my healing. So I'm really excited about having her here with us today.
Awesome.
Yeah.
Thank you so much. It is so great to meet you. Heard a lot about you. So great to meet you.
Thank you all for having me. I'm so glad to be here.
Awesome. All right, well, let's go ahead and jump into it. Y'all know how we do. So we do have some questions and stuff set up, but I think based off of what I was saying in our introduction as well, Dr. Ade, we've been inundated with especially I kind of like to Tony's point about this whole social media thing. Like when COVID happened, social media just kind of went and skyrocketed, especially things like TikTok and things of that nature. And because of things of that, a lot of us who kind of grew up in church, now we're sitting at home and we're kind of trying to connect with church, but it's not feeling the same because, the virtual thing is not there. So a lot of us start kind of exploring different things and start really unpacking where we are, spiritually. And so one of the things that has been a constant issue, and then a lot here recently, is this battle between what a mental health crisis is and what a spiritual warfare crisis or a demonic influence is, right? And so you have tons of situations that are out there where some people are really, I feel like some people are really uneducated, and some people are also well-meaning as well. And so one of the reasons why we wanted you to have on here is because of the credentials that you have, and because you are an overseer of several churches as well. It's like, when it comes to you, from a spiritual aspect, how do you tell the difference between what is actually a mental health crisis versus somebody that is really going through a demonic experience? How is that something that you deal with in your ministry? And if so, how have you been able to kind of delineate between the two?
Okay, well, I think that's a very powerful and important question. And I absolutely have dealt with it, and I absolutely do deal with it. First of all, I where I am now is a result of growth. I used to be a typical Pentecostal pastor. Everything walking is a demon.
Hey.
But
Yeah.
you get to a place where you begin to question why you believe what you believe. And most of us in the pastorate, in ministry, I won't say most, I'll say some, most that I know, it's what was passed down to us. You think just like the one who mentored you, and you take the time to build a sermon, but you don't take the time to really explore. And in my exploration, and I will say one of my vocations, I'm a former nurse, so the medical part helps me as well. But in my exploration, it just became clear to me that we are tripart beings. We are body, we are soul or mind, same thing, and we are spirit. So that all three of those parts can become ill. Illness can hit any part of those parts. So when illness hits the spiritual part, that's demonic possession or oppression. Mental health is completely different. It is. Has to do with the way you think. And we think first, something happens, we think about what happens, we have a belief about what happened, and then we have a behavior. It's a four-part process. Something happens, we think or we believe about that thing that happens, and then the thought is there, and then we behave on what it is we believe. None of that is spiritual. It's all mental because it's here. It's in your thought processes. And due to life circumstances, heredity, due to physiological changes in the brain, at any point, mental illness can come. Now, especially in Pentecostalism, there's always that thought that you're not trusting God enough. Why are you going to seek mental health? No, 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 no. God can do all things, and he can. God is a healer, and he is. But just like I tell people all the time, do you not go to a doctor for your body to make sure everything is well like it's supposed to be? Then that's why you need to go to someone if you're troubled with mental health. Now, to answer the question, how do you know the difference? That part is spiritual for me. I can't say how I know the difference is this is the answer. If you don't know it this way, that's not the answer. No, my answer is I just know. I guess because I've been in ministry for so long, and I have dealt with people who were demon possessed, not oppressed, possessed, where they're speaking, you're listening to a devil speak through them. And we've had to cast out demons. So I really do know what that looks like, what it sounds like. And by asking people questions, sitting and talking with them, I'm able to distinguish whether this is a mental thing or whether this is a spiritual thing. And even if it's a spiritual thing and we deal with it in the spirit, you still got to deal with it in the mental because it's caused some issues in the mental.
Wow, that is awesome. That is awesome to hear. And it's also good to know and that you are, you do rely heavily on the spirit to say, okay, like some of this stuff just ain't right, like just from a demonic possession standpoint. Because same here. So Dr. Ade, me and my wife pastored a church for 7 years, and we had all kinds of people walk through the doors. We have had straight up demonic experiences where some stuff is totally, some stuff has happened. I would say this, like about, and this was before we even started the church. I had gotten a phone call from somebody that I really know and love. And he was like, hey man, I need you to come over here. It was like 3 o'clock in the morning. And I'm like, all right, dude, everything okay? He says, yeah, my wife is acting real funny. And so in the background, I could hear a growling type noise, right? And so he said, the thing that concerns me is she leaned over my ear and said, I'm coming after you next. And I was like, all right. So I jump over there. I go into the house. It feels like 100 degrees inside the house. And I'm like, dude, do you have the air on? He was like, yeah. He was, and I was like, all right. So we go through the whole thing. She's laying on the couch and she sees me and I see her and she says my name, Rob. And immediately right after she says that, I literally saw something feel like it snatched her back. And I was like, all right, this is weird. So, you know, we're going through and I'm praying and things of that nature. And, you know, after praying and I can't remember the whole process of it, but there was a moment where it actually broke, right? The temperature in the house almost immediately became normal. All was good. She slept for like 16 hours. She woke up and she was just like, you know, and she hasn't had an experience ever since. My concern was this, though, and this is why I said this. My concern was this, is because I did not want the hospital or 911 to be called and then them to say that she had schizophrenia or bipolarism or something like that. I just didn't believe that. But I felt that if she had gone to the hospital, they would have pronounced that on her. Okay, so I felt that, and and now I guess, you know, I'm the jury's out with it, but I felt like if they would have said that at the doctor, she would have received that spirit and she would have had to live with that for the remainder of her life, or, you know, or unless she had another, you know, a spiritual experience where that would be removed. So how about that, like about that experience? Number one, well, I guess the main question is, do you feel I was right in that, in saying, all right, don't call the doctor just yet, because I feel like this is a spiritual thing? And it might have just been you know, like you say, just leaning on the spirit. But like when hearing that, what are your thoughts after hearing that story?
Okay, so after hearing that, I think what you did was exactly what you should have done, what you needed to do. Here is the other side of the whole mental health thing. What you have to understand is the majority of people, when you call, and whether they say bring her in or whatever, you're not dealing with people, by and large, that are spiritual. So if you're just trained in mental health, it's a lot like scientists. A lot of scientists, they don't believe in God because they can't, you know, quantify or qualify that he is there. So a lot of mental health, especially psychiatrists, psychologists, whomever would have been treating, they're going to go with what they know. And what they know is probably schizophrenia. It probably wouldn't have been bipolar. It would have been some type of personality disorder. They would have immediately come up with some type of diagnosis, so that they would have, if she had gone to the emergency room, they would have called the mental health department to come evaluate her, and then immediately give her drugs right then and send her home on drugs if they didn't admit her. Right. That would have been the worst thing in the world for her.
Wow.
This is the hard part is a lot of times when things like that happen, the first person that should be called is a person that is sensitive spiritually, but also believes in mental health, because he or she through discernment can discern, wait a minute, this thing is spiritual. If you have a person that is called and doesn't believe in mental health, but just the spiritual part, they're just going to attack it from a spiritual point of view. And there might have been something that was mental. That was a spiritual thing. Schizophrenia cannot come and go like that. A person, there's a chemical imbalance in the brain with schizophrenia, and a person absolutely must be on medication unless the Lord gonna come through and deliver. Because if not, they literally cannot function normally. So it definitely could not have been that.
That's what I was getting ready to ask. Do you believe like mental conditions like schizophrenia, bipolar, do you think those are trauma responses, or like you said, just a natural imbalance that this person was born with?
It can be, anything. Trauma can trigger anything, but both of those, schizophrenia and bipolar disorder, studies have shown there is some type of chemical imbalance. Absolutely. Bipolar is what we used to call manic depressive. Back in the day, everybody, he's a manic depressive. Now they call it bipolar. And it just simply means, and because that's the throw around word now, everybody, he's bipolar. No, most people are not. You can know when a person is bipolar when it's just like it says, it's mania and it's depression. Depression where I can't get out of bed. I don't want to get out of bed. I don't want to eat. I don't want to do anything. Or I'm in the corner. I'm just quiet. Even if I'm getting up and going to work, I'm not functioning. And then the mania part of bipolar is I can clean my entire house in 30 minutes because I'm like this. It's like mania. I'm on speed. The depression part, of bipolar, I just smoked 3 or 4 blunts and I can't do nothing. That's the dichotomy in it all. So very few people that are bipolar. It's like with anything in our society, it is the going mental health term now. I think he's bipolar. No, you probably don't know many people that are. But to get back to what you were saying, Rob, what you did, I think, was perfect, and it apparently worked. It broke. Yeah, it broke that thing, and yeah. So
it scared me
the right thing to do.
Yeah, it was scary. And me being a person who really hadn't, I think I had experienced something recent, just before that felt like it was kind of minor. So coming into this atmosphere and how I'm sitting here, like I said, the biggest trigger, like it felt like it was 100 degrees in there, and it was just really just the whole experience. So thank you for that, because one of our questions was like, should we assume it's a spiritual versus mental? I think you kind of answered that to say that if you have that experience, you should be able to delineate between the two before you quickly attack it and assume it's one or the other. So thank you for that. Any other questions? Tony, Jarvis, I know we got a list of questions here. You all want to answer something or something that you might have just thought of?
Yeah. So we briefly talked about schizophrenia and bipolar and the personality disorders. When we move more towards the neurodivergence, we talk about like ADHD, autism. What are your thoughts about those two? Because both of those fall on the spectrum. So, and we talk about in the group. We've talked about it. We've been seeing a lot of pastors speak out as if autism and ADHD is something to be cast out. So what are your thoughts on those two disorders?
I would never look at either one of those two disorders, whether it's ADHD or being somewhere along the autistic spectrum. I would never look at those things, especially if they have been diagnosed correctly. Now, there's a lot of over-diagnosing of ADHD, especially as it pertains to young Black boys. There's a ton of if they get a little hyperactive, whatever ADHD, it's just, that's why I'm always careful when I'm asking, who should I have my child evaluated by? If they are Black, I always say, go to a Black psychologist. And because they've been misdiagnosed so many times. Absolutely. It is so important that you do that. and so that they can be tested well by people who understand the culture and won't just label them. Here's the thing about ADHD. Several things can cause ADHD. One thing we know for sure, if the mother in particular use drugs, especially any type of stimulant, cocaine or whatever, your child is going to have ADHD. There's no way around that. It's going to happen. That is not the sole cause, but if the mother, use drugs, any kind of stimulant, that child is going to have AD. It crossed over, through the womb. So that child is going to have that. But there can be other factors that causes ADHD. Some are environmental things that happen in the home that might make a child hyperactive. And some are, it's just something that's going on in the brain, because as much as they study, they don't have an answer for everything. They just don't. And I would never look at a child and figure, well, it's got to be some kind of demonic spirit. Now, with that said, I absolutely also believe in praying a prayer healing, because I believe that God is all powerful. And even if a person has been diagnosed with anything correctly, God is able to completely wipe it out and fix it. It's the same way if somebody's got heart disease or kidney disease. What do? We go into prayer. Lord, heal the kidneys. Same thing. God is able to do it. But that does not make it null and void that there is a real issue that this child has. When you're talking about along the spectrum, that spectrum is anywhere, the autistic spectrum is anywhere from low functioning to high functioning. And those that are on the spectrum that are high functioning, a lot of them are at genius level. They could solve math problems that have our heads spinning and stuff like that. But it's hard for them to socialize, or it's hard for them to sit and have a regular conversation. And sometimes what we call common sense stuff goes over their head because their brain is at a all different level. But I would never see any of that as something that needs to be cast out. No, it's something that needs to be treated. It's something that needs to be fixed. Sometimes even behavioral changes within the home can help those situations. Yeah. The thing about casting out spirits, do I believe in it? Absolutely, when there's something that needs to be cast out. But when we look at that as a go-to, we just miss so much stuff that's going on, and that demon just needs to be, everything is just not a demon. It's just not.
Yeah, I was just going to say that because as a mom, and I'm going through this process with my youngest daughter. She was diagnosed with ADHD. And a lot of times I sit back and I'm like, Lord, like me and her are like one of the same. And so it's just she thinks and sees things differently. When I feel like when I allow the Holy Spirit to kind of have me to see the world as she sees it, my creativity is at another level. You know what I'm saying? And so sometimes I feel like the church is not always patient. It's because it's not that cookie cut, you say this, you do this, you act this way. It's like, because now I'm uncomfortable, this thing needs to be cast out. And so what you're saying that it's like, I've come to a point where I was like, Tony, you need to be more patient. Just patience. Don't rush for it. Like, be in this moment with your baby. You know what I'm saying? I might go in her room and her room
Absolutely.
is bad, but she may be putting on a whole Broadway show in her room. Now I go in there and then it's like I'm always doing something. You know what I'm saying? Then I sow those seeds, and then we have negative fruit from me just not taking a moment to parent her and be in the moment with her. So I think that's what I've kind of like, especially with those things, like the church ain't really, I can't take Savannah to a normal church service. Now why the prophet is speaking. She can't go to a normal church service, because she's gonna be up and so that's, I've been thinking about that. Like, we're just not patient enough.
Yeah. But you know what? But I like what you said. Even if the room is messed up, the first thing a parent has got to stop and ask themselves, if this room is a fool right now, what really is the harm of it?
Yeah.
What is the harm of it?
You
Because a
tell my
lot of
daddy
times
that
when a
when
child,
I was growing up.
listen, and I was that parent. I was that parent. Room got to be spotless, bed got to be made. But you know, like I said, I've grown to where I am now. Absolutely, because I look at life like you have to. You know, what is the detriment? I mean, are they going to grow up an awful person if the room is messed up and not clean at this moment? No, they're not.
Yeah.
And a lot of times, children that have ADHD, they are creative, and a lot of times regular life just it's too much for them. They can't sit still in it because their minds are going. So what needs to happen is the parent, the teachers, and everybody, especially adults in their lives, to figure out, so how can we join her or join him in his or her creativity,
Yeah.
so that it's normal for them, so that they're not living in a world where everything, no, sit down, don't do that. No, join me in my creativity.
Yeah.
And that's what doesn't happen oftentimes. And then when you take them to church, you know, that child, you need to cast that demon out.
Yeah.
And there's no demon there to cast out.
They really gave me the left-handed fellowship. I can't go to no regular church with my boo.
Yeah. Me too. Me too. Yeah. Growth is a beautiful thing.
Yeah.
It is.
Yeah.
I know.
Oh
yeah, Jay.
Now go ahead. What you want to say?
No, you're good.
No, I mean, I guess my question would be, well, one of the questions would be from a church perspective, like, I guess what can we do as a church? I mean, I guess from the church perspective, like, it's in most cases everything is a demon, and it's very few that have even taken the step to even want to look at it as anything different, want to look at it as oh, this is something that's unique, and how do we embrace that and give the correct help there, versus everything just cast out, and then the person go home and I wonder why this demon ain't left my child. Because now this person has thoughts behind in their mind of like, maybe it didn't work, maybe God punishing me, now I'm cursed. You know what I'm saying? So it leaves these doors wide open when it comes to those things. So how do from your perspective, like how can the church get better at this? Or what should we do?
Well, and I don't even think it's difficult. It's the leaders getting to a place where they say, wait a minute, it's always about the why. Why do I believe everything is a demon? And I guarantee you, they won't even know it's why they believe it. They believe it is because it's what it's always been.
Yeah.
The pastors on top of me believe that, and the ones on top of them believe that, and the ones, so it's if they all of them believed it, they all can't be wrong. They have to be right. But who is the one that says, wait a minute, let's pump our brakes. Let's open this word. Let's study. Because I've never met a person that fits in the category that you all are talking about, but have issues with physical health and physical doctors.
Mm-hmm.
They ain't trying to cast the demon of diabetes out.
Yeah.
Or the demon of high blood pressure, because most of them have high blood pressure.
It's quick. It's just quick.
Yeah, most of them have high blood pressure. If you're black and over a certain age and a little bit overweight, high blood pressure you got, and probably diabetic, but ain't nobody trying to cast them demons out. I mean, why? Because they are not demons.
Yeah.
But it starts when the leaders say, I've got to rethink what I've been teaching, what I've been preaching, and I've got to understand my own why. I always tell people, once you research and find your own why, even if your thought doesn't change, at least you know this is your why, and not the why that's been put in you year over top of year over top of year. I remember as I evolved, as I grew, I would go back to my congregation And I'm not trying to pat myself on the back, but this is something. You got to lower your pride because most pastors won't do it. I would go back to my congregation and say, I remember preaching and teaching a sermon 5 years ago. I'm at a different place. This is what I've learned. That was error. I taught you all in error. There is a pride thing that is attached to the pastorate. And I know pastors that even when they have learned something that is error, the pride will not let them go before the people and say no. And it's also an encouragement to, like, I pastor pastors now. I have a lot of ministers under me. I'm always asking them, what is your take on this? Because you're just as wise as I am. Let's study this thing together and let's talk about it. Come, let's reason together. What's your take on it? Because I'm open to hearing what your take is. I'm going to pray over it. I'm going to do my own research and see whether we'll have the same mind, but I'm certainly open to learning something new that I don't know now. And I think for the most part, a lot of pastors are just not willing to do that. So it is going to take then congregants asking more questions, and that's something that usually doesn't happen too, because for the most part, people come to church to get the word and then they go home. But it takes congregants saying, wait a minute, I have some questions here. Can we sit down? Can we talk about it? Can this week's Bible study be about these questions that a few of us have? It takes that kind of thing. That's what's going to bring about change.
Yeah. I was going to ask you, what with your growth and continual learning, what has been your biggest challenge with pastoring other pastors and just people, and even as a therapist? Like, what has been the biggest challenge in that? Nah, baby, you need to sit down and think some stuff out. Or, nah, baby, you need to go get a pill. Like, what has been like your biggest challenge? What's the biggest hindrance with it in that area?
Well, first of all, okay, so that's kind of like a two-part question. The first part is the pastors that I oversee now are of the same mindset. The ones that weren't left me.
Yeah.
They left. They weren't of the same mindset. I'm like, well, okay, I got a strong back. I can take it. But it is there are those times where it's kind of like walking a tightrope. What is it? Does this person need to, as we say, sit on somebody's couch, or is it sometimes it's just a little passing thing? We can't forget that it's normal to go through seasons.
Yeah.
It's normal for each one of us to have a time where I just feel depressed. It's I always tell people, rest in it. Let it come, envelop it. Don't stay there. When you feel that you're staying there and you can't get out of it, then that means now I need help.
Yeah.
It's like right now we're in a season. I don't know if you guys are experiencing it, but we're in a season where there's just so much death. I have never in my life seen and heard of so much death. It used to be a time you got old, 80, 90, whatever, and you died. I'm hearing 30 and 40-year-olds are leaving here. I've never seen so much. And it's normal. It's natural to grieve and to be depressed. This is someone I thought I'd be having 20 or 30 more years with, and now they're gone. You don't necessarily have to see somebody. That's normal. That is absolutely normal. But if you feel that I can't shake it, I cannot get out of it, now you need to see somebody. And ain't none of that demons.
Yeah.
None of it. It's normal things. God put these emotions in us. And so we go through sometimes emotional roller coasters. We up 1 minute, down the next minute. It's when we feel that we cannot regulate ourselves, or when we feel like I am really going around that same circle, or I've hit a brick wall. I need somebody to help me get unstuck. That is when you need to reach out. And sometimes it doesn't even have to be an issue. Sometimes it's good to reach out. Like, I just need to do a mental health check to make sure I'm good. But, I call Tony, I call my work spirit, mind, wellness, because I think the spirit and the mental are supposed to work together. Absolutely. And I think more pastors, ministerial leaders have got to get themselves more knowledgeable with the mental health part so that they know what is the difference between, okay, you really need to seek mental health, or this is something I can pray with you right here in my pastor's office, and we know God's going to break that thing.
Yeah. And I think that becomes sometimes, like, especially I see it sometimes with I talk, speaking to other pastors and especially men, like they use this term like just push through it, just push on through, push on, they can be physically tired, mentally tired, whatever the case may be, and I'm gonna just push on through for the Lord. It's like, no, bro, just go take a break. Like, go sit down somewhere.
Take a break.
Take a break. Let somebody else preach today.
Mm-hmm.
And especially like with Black men, it's just you see it a lot. I see it a lot with, and even with my nephew was just talking this morning, and he's just trying to figure stuff out, and I'm like, just trying to push through. And like you said, some of it is prayer, some of it is, all right, take a break. Let's look at this thing. You're overthinking, you're overstimulating yourself, and then because when he start acting out, people gonna, the church may start calling it a demon. He got this spirit done jumped on him right now. Now he mad. No, it might have, you just can't figure out life right now. And that's what's being to tell right now. But it's not a demon like you're saying. So I mean, it's we got some work to do on that.
We do. And I mean, and you have really hit the nail on the head, that when you said that take a break is important. Take a sabbatical, take some time off. Not enough pastors do that, especially Black pastors, especially Black male pastors. Not enough do that. There is a theory that is called effort reward imbalance. Effort reward imbalance. And it is a theory. It started off, if I'm not mistaken, by I don't know, it was a psychologist or sociologist. It started off about the workplace, but then there were researchers who put this theory in the church, and primarily in the Black church. And effort reward imbalance posits that there is an imbalance with pastors or ministerial leaders with the amount of effort that he or she puts out and the amount of reward that they receive back. In other words, you're praying, you're preaching, you're pouring, and people are pulling. So you are giving out all of this effort, but you're getting very little reward back oftentimes. And the biggest cure for that is take a break.
Mm-hmm.
Take a break, regroup, let somebody else handle a couple services or whatever. You take a break away. And if you, during that break, need to seek some counseling, then you do that. Because by and large, when you get back to pastoring, it's not going to change.
Mm-hmm.
It's still going to be that imbalance. And in the research, they research a variety of different denominations, and almost all of the denominations suggested that their pastors seek help outside of the pulpit, outside of the pastorate, get some counseling. Pentecostal pastors were the ones who absolutely said, not only would they not seek the help, they would not encourage their congregants to seek the help, because that shows a lack of faith in God.
I also want to ask you that. Do pastors not take would you say that that's more ego? Like, if nobody else do it, I got to be the one to do it.
You got to be the one. But here, it's ego, but it's external ego. It's ego that comes from pressures from everybody else. It's because you're looking at this congregation. They expect you to be the strong one. They expect, most pastors don't. And I have a couple pastors, male pastors too, in Atlanta that are clients of mine. I'm sure their congregation don't know that they come to me, because there's this expectation. Oh my God, not my pastor seeing a therapist. Well, your pastor is doing what he should be doing.
Mm-hmm.
He absolutely should be doing it so that he is his best for you.
Yeah.
And it's an ego thing, but it's also that pressure you know, to that pressure to perform. You know, when you think about things that happen in a pastor, that pastor is usually the one that's called for that the highs and lows. The pastor is the one that's called to perform the wedding. The pastor's the one that's called to perform the funeral. And they never are helped through their emotions for all of this. You know, I pastored for years, for 26 years. And, you know, I preached a few funerals. And two of them, my mother one and another young woman, well, she was in her early 40s, so young woman, belonged to our church. I was hurt and I was devastated, but I still had to be pastor.
Yeah.
Still had to be pastor. And although I was close to these people, my phone never stopped ringing. Pastor, I need. So, you know, I think on the defending the pastor's part of it, it's they have to get to the place where they say, wait a minute, I'm going to take this break. You know what Jarvis was saying? I'm absolutely going to take this break. My mom's come to think about, I think my son preached her funeral. I don't think I was able to, but it's understanding that you can only do so much. The church is going to require everything of you, but you can only do so much. And as you're taking that break, pastors, if any of you are listening, start studying. While you're taking that sabbatical, start opening up your mind to mental health and to other things and understanding everything is not a demon.
Yeah.
That's good.
Do you think that the church overall, congregants, all of that, is it different now than it was 10, 15, 20 years ago? Do you think people are more open to like, hey, my pastor is human? Like, go on your vacation, pastor. Like, do you think it's a different expectation now? But because,
I think the younger the congregant is, the more true that is. Okay. I think the older they are, look, I'm 66, almost 67. Most folk that my age, that is not the case. they stuck.
Yeah.
A lot of them are just stuck. And but pastors are leaving the pulpit. Pastors are committing suicide. So it seems as though congregants would want to do anything that they needed to do to make sure that the pastors are well, so that those things don't happen. But I think that, well, you know, we Generation Z, everything is, child, whatever you want to do it. The Generation Z that we have now. So they would be fine. They'd be like, can I go on the cruise with you, pastor? They would be fine. And I think millennials are more open. They're like, you know, career minded and more open. Yeah, you need to take a break. I think the age group older than that are the ones that really want that pastor to be in that place. And they're the ones where the expectations are high, really high. Yeah.
It's funny that you said that, because like I was saying at the beginning of the show, my wife and I pastored for 7 years, and we actually closed the doors in May 2021. And it had taken such an attack on our marriage that we were literally at the point where it was just not going to work. I remember having several conversations with Jarvis just talking about that. And the hardest thing for me, well, for us both, was to turn around and tell our congregation, like, listen, we have to work on us or else we're just not going to be here, whether that's us being divorced or something more or worse, right? It was just taking that much of a toll on us. And I have to say that for our congregation, because of the way that we taught, we always taught with love. We always taught with the focus on self-love and self-worth and self-value. Our congregation was like, man, y'all go. Y'all have given us everything that we have needed to carry out this spiritual journey. And now when we see them in doing all their different things, joining different churches, we see them that they have grown and that they've developed amazing leaders and all these different things. And so even the times that I still feel like, man, like we really still could be doing this, when I look on social media or when I have conversations, I'm very glad that, you know, that we did something right, and just saying, like, we stepped away and that we spent so much time pouring into them. Because like you say, like, the requirement, you know, they're your best friend today, and then you say one wrong thing across the pulpit that they disagree with, and they're gone. And you're sitting there trying to figure out how to be a pastor and also have how to have a regular relationship with people. Because if you still want to have friendships, you still want people to be able to talk to vent to, but you can't always talk to those people that are your congregants because they might look at you funny, they might tell other folks, they might lead a church and all these different things, but you still desire that friendship. And I really believe that's why a lot of pastors are doing the things like committing the suicides and even shifting over to this egotistical part as well, because everybody is forcing them to do this. So they have taken on that. Maybe they didn't start that way in the beginning. The pastors that I know that have kind of gone that way, when they first started pastoring, they were all about loving people. They were all about doing these things for God. But there was something somewhere, or maybe a multitude of things that happened somewhere where the shift happened and they felt like they had to carry it and they couldn't let anybody know. And then, they had passed away or what else, that's where we are now.
I know it. It's that, and that thing will eat you up on the inside when you feel that you cannot share. Here is the thing, and I agree with what you're saying. Nobody starts off over there. You start off with the pure heart. You start off and things happen, expectations, not being able to show my own vulnerability. Those type things happen. And I am an advocate for pastors being vulnerable to a certain point. I mean, certain things that go on in your home, they go on in your home. But there is not a soul who knows me that doesn't know I'm going to have me a glass of red wine every night before I go to bed. Now, I wasn't going to always say that. I would not always say that. Why? Because, what will they say about me? I am so far past the point of what people say about me. I just am. The ones that didn't agree, they left. So I guess everybody else with me at this point. And you're going to always have people from afar that look, and a lot of the judgment comes from peers. Pastors, the judgment will come from other pastors who look down on you, but in their house, stuff is going on. But when they come out, they make it look like it's you. No, I'm being vulnerable because I'm letting the person know if you have a glass of wine, you have not sinned and God ain't going to send you to hell. That's what I'm doing, as opposed to you behind closed doors. So it's those kind of things. I'm so glad that you taught your people the way that you did. And I'm also glad that you and your wife stepped away when you felt you needed to. And here's the thing, you never know what God's going to do, Rob. If he calls you and your wife again to open up doors again and pastor, you put those things out ahead of time. Like it seems so crazy, but if I were to open up another church and pastor, I would let them know 2 months out of the year, I'm going to be on sabbatical. I'm laying down the law. So that way, going in 2 months out of the year because of effort, reward, imbalance. I already know I'm going to be pulled over. So for 2 months, might not be consecutive, but beginning of the year, the end of the year, whatever, somebody else is going to be heading this for those 2 months. You do what you have to do so that you don't lose yourself, you don't lose your house, you don't lose your voice. Always.
Yeah. Why do you think we can't? And we don't talk about this. I'm not very vulnerable, but why is it so hard in the church? Like, because I feel like that's the key to the breakthrough of everything. Like, if I just had a new baby, I'm struggling. Why I gotta try to make sure the baby's got on cute outfits and we going to church and we showing up and we smiling and we look good as a unit? Like, because I know I went through postpartum depression twice, and I had to realize, like, girl, this is you putting pressure on yourself. So why is that vulnerability so hard when everybody really wants to be accepted? Everybody wants that safe place. Why is it so hard for believers?
I think a lot of that is Black culture. I think a lot of that is our culture. We got, you just feel the pressure that you got to look your best. You got to be your best. Well, if you're a mom, well, she should have on this dress or whatever. I think, and a lot of that comes from church culture, by and large. It just does. It's, when you think back on growing up in church, how things always were, there's this precedence that, and a lot of this stuff is unwritten. Nobody is verbally saying it out of their mouths, but it's just stuff I'm supposed to adhere to. But then the question is, but who says?
Yeah.
Who says? Because then nobody is there. The people that you feel pressured that I got to present myself in a certain way, none of them going to be there to help you through your depression.
That's what I was saying.
It's not, they're not there for that. But so it's not adopting an I don't care attitude. I don't want to ever encourage that. But it's adopting what I call a self-focused attitude, which I call self-care. I've got, if me showing up to church with my child with a t-shirt and a diaper is going to cause me to be mentally healthy today, at least me and my child are in church. That's what we're doing. And it's not being, I don't care about so-and-so, but in a sense it is. I am concerned about what makes me feel healthy and moving yourself from those pressures, because no one has the right to pressure other people. And most of the time, the people that do the most pressuring are very unhappy in their own lives. Because people that are happy and satisfied, they ain't got time to be trying to pressure you into stuff.
Exactly.
Absolutely.
But it's a lot about, our culture. That stuff is generational. We've experienced it in church over and over and over again. And it's, a lot of it is harmful behavior. It is, when a person just feels like, well, I can't fit in, and don't want to talk about the fact that I am depressed. Postpartum depression is a very, very real thing,
Yeah.
Yeah.
And I think I've seen it a lot of times, like you said, within our culture, is you don't say what's going on in our house,
Yeah.
That's one of those things that get passed down too. Is like, whatever problems we have in our house, you don't bring that on the outside. And then sometimes it's like you may need to, and whatever the case may be on some of those things, especially as a child who's seeing his parent or mom getting beat on. But I can't say nothing to nobody, but it's bothering me and it's affecting me in so many different ways.
Oh, absolutely.
Then kind of going back to some of the behavior issues may stem from it, because I'm angry and mad at dad and I can't whoop him, but I can whoop you, like he's doing.
And you're absolutely
wrong.
right.
And it becomes those type of situations. So I agree with you there.
Yeah, I mean, that you nail on the head again. You're absolutely right. And any child that sees their parents being beat up, but one beating up the other, that is just automatic PTSD. That child is growing up with PTSD. Absolutely. It's no different than a person that's going off the war and seeing some horrible things, because it's a lot like what you just said, Jarvis. They can't step in and do anything about it, but they're hearing it and they're witnessing it all the time. And that behavior is going to exhibit itself somewhere else. It's going to show up somewhere else. A child walks past him and bumps him by accident, and next thing you know, he done choked the child out because of all of this PTSD. Yeah, that stuff is real. Yeah, and the church is where we need to be talking about all of this. All of this. It's supposed to be that place where we talk about all of it. When we need to get information, we go to the church to get it. But the leaders, again, have got to get themselves in a place where they'll say, let me open up, my sphere of knowledge. Let me learn. Let me bring in some people that are knowledgeable in this area to teach me and my people, and not be concerned with but Pastor Brown down the street. If he hear I'm doing this, now my name going to be bad. Did you hear that he was bringing in? You can't be concerned about that, because when the pastor is supposed to cover the soul, the solar realm is the level of this. Our mind, how we think, our thoughts, will, desires, all of that. That's our soul. So if I'm covering that, I've got to bring to you the things that's going to help you stay well in that area.
Wow. So
I
I got one more question, and this kind of goes back to the beginning of the show. So there have, again, countless social media videos. There was a specific video through actually somebody that I know was praying for somebody, and she was praying about, I guess, ADHD and autism or something like that, and saying, I bind this in the name of Jesus and all of that. And there was actually someone who did another, like a response video saying, what happens when the child comes home and they're not healed and all that. And my thing is this, like, everybody's going to have their opinion on how things go. Some, you're going to have some pastors that are really going to be outspoken about this, some that are not. But in the case when things hit social media, and then it seems like everybody kind of digs into what they believe, they lock their knees, and then that's it, right? And when I was looking at the video, I saw both sides. I saw the young lady who actually had a child. I guess maybe Tony, is her child autistic? I don't remember.
That hasn't been confirmed, but
okay.
Based on my observation, I think that was the concern of the mom, that he was
okay.
autistic. Yeah.
So the mom that kind of made a comment about the video, she possibly has a child that's autistic. But I was looking at also the other side, like, because me being a pastor and really having a heart for people and really seeing this lady as well saying that, this is what she was taught to believe, and she really wanted to see that child healed. I guess my whole thing is this, like, when things hit social and they get amassed to like millions of views and everybody's digging in, right? How do we approach that from a pastoral standpoint? And how do we approach that as observers of the video as well? Because I just see people kind of they just go off the rails, and they just kind of, everybody just starts to start chiming in and saying different things. But how should we approach that from the standpoint of us watching the video, and then from the standpoint of us being pastors and leaders? How do we address these other leaders, or how do we how do we address these other leaders, or how should we approach it if it should happen to us?
Yeah, if it should happen to, well, I am an advocate for forums. I'm an advocate for bringing people together. Let's sit down. Let's have a discussion. Peers, let's sit down. And as you're saying, we're not going to always agree, but we need to handle this. And so here's the thing. When I'm thinking about autism, I'll just take autism and even ADHD. When I think about autism, especially in the mid to higher end of the spectrum. So I understand praying for healing, but healing from what? I think in our society, we have what we believe are norms, but who says they have to be the norm?
Come on,
if
Phil.
I have this child that is different from what you believe should be right, but we've learned how to work with it, and I'm seeing some genius. This child can do stuff that your child can't do. What do I need this child healed from?
Yeah.
It's the changing of our mindsets. That is it. We get so locked in, and I understand exactly what you're saying. I was scrolling through something on IG yesterday, and it was a couple on there, and they were saying that you should know within 2 years of dating somebody that, whether you're ready to marry them or not. They said, we're not saying get married in 2 years. We're saying 2 years is more than long enough to know. Well, the comments were coming in. You should know by 6 months. You should know by this. And I usually just read, to see what people's mindsets are. And I just put a little thing. I says, well, I'm a couples therapist, and I know a couple who met within 6 months, were engaged, and now have been married for 2 years, and they're doing quite well. I said, you don't have enough information. There's so many different factors, and I think that is the problem. People chime in with little to no information. They will read the original post and they will go to town on it, and you don't have the information. What I posted yesterday, I was like, somebody else, it might take 5 years or whatever. It has to do with your upbringing, your belief system. A million components go into this, the same way with that autistic child. You know, and far as the pastoring part goes, I think again, that's where we have to reach out and have conversations, because what we don't want to do is confuse people. So now you have a heart of love and you're helping this mom understand that her child is fine. And something happens and she talks to another pastor that ain't his or her point of view. And now they are a mess.
Yeah.
We have got to reach out to our peers and have these forums, these sit downs. Let's talk it out. Let's because even if we don't agree, I'm going to learn something and you're going to learn something. Yeah,
absolutely.
But it is difficult. I'm never against a person praying for healing, but what I'm always advocate for is, what is the person requesting? What is mom asking for?
That's what I was about to.
What is dad asking for? You know, I do it now. I preached a lot of funerals and a lot of grief and stuff. And I'm a former nurse. I used to be a private duty nurse, and cancer and full-blown AIDS. That was back in the early 90s. That was how I ended my nursing career. My nursing career ended with all of my clients dying because they either had cancer or full-blown AIDS. Now, I'm a minister at this time, pastoring at this time. And what that taught me was, even when people call me and say, could you come and pray? So-and-so, it doesn't look good. When I get there, if that person is coherent, first thing I ask that person is, what is it that you want? I know your mama, I know your husband, I know your wife wants you to live and stay here. What is it that you want? Because I'm going to pray according to God's will and your will. That's what I'm going to pray, because you're the only one that's in that body. And you know, if you are ready to go and be with the Lord, I'm going to pray that. Same way if the child with autism, ADHD, I would want to know, mother, before I pray, what is your will? Tell me a little bit about instead of just laying hands down praying, you know, I pray for, what is your will? What are your thoughts about what's going on with your child?
Yeah.
And then I take it from there.
Yeah, that's such a good point, because I think when I watched the video, my thought process was that, and also what had the mother seen or thought, had she seen something different? Because you do hear the stories of, my child, you know, was diagnosed with autism and they don't have it. But then we have the extreme part as well, as what you were talking about earlier. My child was diagnosed with ADHD and they didn't have it really, but they were misdiagnosed. So you have all these different things that could even be swirling around, that the mother could say, well, I saw this person was healed, so maybe my child can be healed too. So there's just so many different factors that kind of come into it when I'm watching the video. And I was just kind of like, I don't know, man. This is one of the things that I'm just like, that ain't me. I'm praying for everybody involved, and you know what I'm saying? And I'm gonna go ahead and enjoy my life, because stuff like this, you know, getting millions and millions of views on stuff like that, it actually can weigh on the mental of everybody involved.
Absolutely.
Even the pastor, the kid, and the mama. You know what I'm saying?
Absolutely.
I think it's a good approach to just approach everything as a spiritual match. Like, be quiet and, okay, Holy Spirit, what is, you are all knowing of every situation.
Absolutely.
Instead of the default always being, this is not normal, this is demonic. You understand? Like,
absolutely. Like,
instead of like, oh, well, no, the Holy Spirit could have told you, Mama, give him a detox bath, or Mom, take this out of his diet. You know what I'm saying? We got to get out of that assumption. If we're saying we're going to be led by the Spirit, let's be led by the Spirit and don't speak for the Holy Ghost.
That's right. Oh, that's powerful. That's powerful right there.
Yeah.
That is powerful.
Whether it's diet, environment, or like I said, you got to sit down and I was always against, like, I don't need no medication. And I haven't taken it this year, but anxiety medication helped me calm down. You know what I'm saying?
Yeah,
Like
yeah,
after the second bout with postpartum depression, like my doctor had to sit me down, like, Miss Pope, like, are you stressed about? Are you anxious about anything? And even though in my mind, I'm like, nah, my body was like, yeah, girl. You know, so like, I haven't had to take it. I'm not dependent on it, but I thank God for the wisdom to say, hey, you need a little
absolutely
help. Yeah,
absolutely.
So we gotta let the Holy Ghost do what he gonna do.
That perfect point. Yes, he is because what? He knows everything. He's the one that will let you know whether this is spiritual, whether it's mental. Yeah. Absolutely. Yeah. We can't be cookie cutter with anything. We can't be. Yeah.
This was great, y'all. This was great. Thank you, Dr. Ade, for just spending this time with us today. I know, I know we could go on, but I know we also have things that we all need to do as well. But thank you so much for just taking the time out to kind of helping us unpack this, because this is just going to get bigger and bigger and bigger and probably more polarizing and more polarizing. So whatever we can do to even offer, putting this video out there on our Unlearning Religion YouTube so people can be able to see it and digest it and start even being able to take a lot of your words and kind of do with it, with the forms and things of that nature. So we really, really appreciate you for joining us today. Does anybody have any last thoughts or anything before we go ahead and land this plane?
Nah, it was good.
Yeah, it was good. It was really good.
Dr. Ade, do you have any?
Listen, I enjoy being with you all, and thank you so much for having us, for having me. Thank you so much.
Awesome. Thank you so much for being on. And all right, folks, so that's a wrap. Thank you all for joining us for another episode of Unlearning Religion. Remember, like, subscribe, share this with your folks. We're going to have some more coming up to you. And we might even have some more virtual, because I kind of like the way this virtual setup went. It really went pretty good. So thank you all for joining us again, and we will see you all on the next episode.